And I love your work as an overall, because I think pelvic health and the postpartum issues that women fall into are shrouded in shame. And I remember I took my kids to a trampoline park. I can't remember, like, it was someone's birthday, or maybe we just took them there for fun or whatever. And I remember posting it online, and I had women DMing me like, how I could never.
How are you doing that? Right.
How are you doing that? Are you wearing a pad? Like, I could never do that because I would literally soil, like I would pee myself. And so let's talk about urinary incontinence. I think that this is one of the things that is, nobody wants to talk about this. So we're going to definitely talk about it. So
yeah, that's my specialty. Yeah. Peeing and pooping, my favorite two topics.
Yes, let's go there. So let's talk about the different types and what that might look like. And then you mentioned Kegels, which I want to talk about as well.
So, urinary incontinence is when you unintentionally or involuntarily leak urine. And there actually is no amount of leakage that is considered normal for a woman. So it's common, but it is not normal to leak when you cough, leak when you sneeze, leak when you're running or jumping. And what happens is that those pelvic floor muscles support the bladder, and they close the urinary sphincter to prevent urine exiting at an inconvenient time. If that muscle gets weak or too tense or incoordinated, it's not going to activate that we need it to at the times that we need it to. So stress incontinence is when there's leakage with pressure. So pressure from a run, a jump, a cough, a sneeze, a laugh, where that sphincter, often it's weak, is not supporting that bladder and closing it off when urine tries to exit. Urge incontinence is that leakage that happens when you've got a really strong urge to go. So I see a lot of women have this when they're washing their hands, and the sound of water kind of triggers the urge, or they get home and they're putting their key in the door and they have a strong urge and they can't hold it in time. Or you're getting to the bathroom, you're on your way there and you can't quite make it. That's urge incontinence. And those are two different things, because oftentimes we just focus on Kegels to tighten the pelvic floor. But with urge incontinence, sometimes you can have over tense muscles. So the muscles are like too tight and they're not signaling to the bladder, hey, I'm full, chill out bladder, I'm going to go in a little bit. And so that signal kind of keeps going on in the bladder, and then you just leak yourself. So it is important to kind of discriminate, one, which type of leakage you have. And you can tell just from listening to this, you can have either of those or you can have both. Some lucky folks have what's called mixed incontinence, where they get stress and urge incontinence. But it also helps you know which pathway of treatment to walk down, because not everybody needs pelvic floor strengthening or Kegels. A lot of people need relaxation and softening and lengthening the muscles. And then if there's weakness, they can work on strengthening. So it's unfortunate, because I think our whole history as women has been like, tighten your vagina, pull in your core, better sex, do your Kegels, when it's like saying if you have back pain, just do a bunch of crunches. It is so much more sophisticated in how to approach a pelvic floor issue than do Kegels.
Yeah. Let's talk about the name Kegels just for a moment.
That they're after a man, which is like...
A man has named the contraction of some of the muscles in the vagina and, of course, through the pelvic floor after himself. How lovely.
Yeah, not surprising. But, Arnold Kegel was a researcher, and he did a study on inserting a device into the vaginal canal of postpartum women and assessing the strength. And the contraction of this muscle to assess the strength is a pelvic floor muscle contraction, but named after himself, he started calling them Kegels. And so that is kind of the universal name now. And if my life's work may be just trying to change that name, because I feel like there could be a better name for them. But I refer to them a lot as Kegels because it's a familiar term, but they're also just pelvic floor muscle contractions, which is thinking about stopping your urine stream, holding in gas. It's the kind of the front and the back part, a squeeze and a lift of the muscle to support the pelvic organs and close off those sphincters.
It's almost like if you were zipping up a zipper, it sort of feels like that, like sort of in and up. And there's a scene, and maybe we'll put this in for when we promote this on social, but there's a scene from Sex and the City. I think that the four girls are like at a bar or they're at a restaurant or something, and they're talking about, like, one of them had given birth, so they're talking about the importance of Kegels, postpartum or whatever. And then Samantha, the sort of very,
racy,
yeah. So she's like, I'm doing them right now.
Right.
Like very demurely, she's like, I do them all the time. I'm doing them right now. And it was such a great moment for, I guess, pelvic floor health. But I love in your book, I'll just read this out. A friend of mine recommended we started calling them puss-ups.
Right. Which is a genius term. And I'm like, I'm back that. Let's go there, So
I love it. I love it. Okay, so so a Kegel, from what I'm understanding, and redirect me here, but for strengthening
correct.
a weakened pelvic floor. So give us like a clinical itinerary or checklist, let's say. If someone has a weakened pelvic floor, what might be some signs and symptoms that she might experience?
So I think some of the common ones, and I actually go through this in the book because without seeing a pelvic floor therapist in person, it's like, how do you really know? But there's some general pathways that, people fall into with weakness and they need strengthening in Kegels. Typically, urinary incontinence is one where there's leakage. Another one is actually fecal incontinence. So we don't think about leakage of stool, difficulty holding in gas, or even fecal staining, which is like smearing in your underwear, feeling like you can't get clean all of the way. Pelvic organ prolapse, which is when your pelvic organs aren't as supported by your pelvic floor and they start to kind of push into the vaginal canal. It's actually very common. I would say most women after giving birth have some sort of pelvic organ prolapse. But again, it will progress with time with increasing activity without rebuilding your pelvic floor and your hormonal levels changing with age, your estrogen levels, your testosterone levels decrease, and those kind of help plump up the pelvic floor so we don't have that hormonal support as we age to help pelvic organ prolapse and leakage. So I would say those three, but even things, we think about, Stephanie, like hip pain, back pain, weak core muscles, this what we call diastasis recti, where, you have given birth and it still looks like your belly is pregnant, but you don't have a baby anymore because your core is so stretched out. These really common postpartum issues that I think women experience, and they don't realize that there's help for them. They're just kind of like, oh, I guess this is just my new body or my new life and I have to deal with it, which is not the case.
Yeah, and to your point around the importance of getting checked, I mean, there's so many things that can overlap. In the book, you had put a couple of lists together, and one of them was decreased sensation with sex and weakened orgasms, which certainly can be a weakened pelvic floor.
Absolutely.
And it can also go in tandem with decreased sex hormones as you're going through perimenopause, et cetera. So I do think that it is really important for us to be getting checked out. And would you recommend, I want to talk about lengthening it, because I think you had mentioned fecal incontinence, but I think constipation is also worth chatting about here too. But before we get there, do you think it's worth, like, if any woman who's had a baby, do you think that it's worth it, even if the baby is now 15 or the baby's 25, is it worth going to a pelvic floor therapist to get checked out to make sure that there isn't any asymmetries or tightness or or the maybe prolapse that has persisted and now potentially getting worse? Is that your recommendation?
100%. I mean, in my ideal world, every postpartum mom would see a pelvic floor therapist at 6 weeks postpartum, just like they see their medical providers. And then if they need additional work, they kind of continue pelvic floor therapy. We know that those first 3 months are really important, and the first year, because if someone's still experiencing an issue at 3 months postpartum and it doesn't get addressed, they're likely to still be experiencing it at 1 year. However, it's never too late to go. I mean, I've worked with women who have had teenagers, they have 30-year-old children, and they have C-section scar restriction and it's causing incomplete bladder emptying and UTIs. Or they have scar tissue at the vaginal opening and they're like, sex has never been the same, and now they have vaginal dryness and they have pain with sex. Or, with aging, their orgasms are getting weaker and now they may even leak during an orgasm. So all that to say, you don't even have to have a problem. I'm like, just go in and get evaluated. Every state in the United States, you can get a physical therapy evaluation without a referral from a physician. So if you have a physician who's not willing to provide one for you, you can literally just walk in and get an evaluation. And if they will say, you know what, you're doing great, maybe here's a couple things to think about, or actually we're finding a little bit of weakness. How are you peeing? How are you pooping? How are you exercising? And they can really put you on a path of healing and healthcare. And, at perimenopause, which I'm in right now as well as a 42-year-old woman, it's not great, it's a little bit of a mystical time where you're like, oh, why is my hair falling out? Is it stress? Is it hormones? Why are my poops hard? Why am I, a raging mom 3 days out of the month? But I also think that it's an opportunity. And because we're getting a runway that we know our hormones are going to change. I think with pregnancy and birth, it's such a quick change. It's like happens all of a sudden, and then you have a tiny human to care for as well. With perimenopause, I'm like, we get this runway. We're like, okay, it's coming. Start your strength training. Start your optimal bladder and bowel habits. Take care of your nutrition. So you can really start building in these habits to optimize your lifestyle. So when menopause does hit, when you haven't had a period for a year, you are in better shape and have better pelvic floor health than you would have if you hadn't done anything.
Yeah, I can't love that more because one of the through lines of the show is get your ducks in order, right? It's like, I am a really big proponent. I'm a chiropractor. So of course, like bone health and, the skeletal system, the neuromuscular skeletal system, really big area of focus for me. It's like build your muscle. Don't be sarcopenic. Don't be osteopenic. So that when you do lose those hormones, let's say, that you have you've stacked the deck in your favor. And it makes perfect sense to me why you would also loop in pelvic floor health there. Like you don't want to be going into perimenopause and then the eventuality of menopause with a weakened pelvic floor, because it's not that it can't be changed, as you're saying. It certainly can be. Oh,
it's so fixable, right?
But it's just better. Name of the show. It's better if you can start earlier, right? It's like the best time. The best time to start was 10 years ago, and the second best time is today.
Yeah, I love that. I really do. And the research is clear. It's like women know more women experience urinary incontinence than osteoporosis and high blood pressure. But how much do we hear about menopause and high blood pressure and osteoporosis? But it's like more women have urinary leakage than any of those issues, but we're not getting talked about that. Like we get DEXA scans for our bone health,
right? And
we're like, oh, because we're at risk for a fracture. But if you're running to the bathroom 4 to 5 times at night because you pee your pants, or you have, urinary frequency, that's going to put you at risk for a fall. Like, let's backtrack and look at the source of some of these symptoms and why our habits are the way they are, than just like, oh, let's check your bone health, let's check your cholesterol, let's check your heart health. I'm like, your pelvic floor can change your whole life. It's one of the number one reasons for admission to a nursing home later in life is fecal incontinence and urinary incontinence. And so if you have one of those two things, you're at a higher risk of ending up in a nursing home than if you don't. And I think that can really help kind of put an alarm bell for something like, oh, I really do need to address this because it's not going to get better with aging.
Yes. Well said. Well said. Okay. So let's talk about, we've been talking about the pelvic floor that is weak potentially. So this urge incontinence, stress incontinence, maybe the weakened orgasms, the pelvic organ prolapses you've been discussing. In the book you talk about, I think you call it a knack. So I wanted you to share that here.
It's a good one. It's a good tip.
Yeah. So why don't you share your tip?
So one of the things that happens with our pelvic floor after pregnancy and birth, but even just with aging, is that it just doesn't fire as quickly as we want it to. And so even if you're doing pelvic floor strengthening, you have to learn to turn those muscles on when you need them to work. So if you're leaking with a cough or a sneeze, I encourage you to kind of Kegel before you cough or sneeze. So I say Kegel before you cough, squeeze before you sneeze, because that's going to activate those muscles before the pressure of the cough or sneeze. So when it's coming, instead of just kind of like letting it happen, Kegel, contract, and then cough or sneeze. And especially if you're chronically coughing, I'm like, sit down, give your pelvic floor a little more support if you're having a coughing fit. That's going to help you cross your legs and Kegel if you are sneezing a bunch and you're standing. You really want to turn those muscles on as much as you can to counteract that pressure. And it's a really easy way to kind of try to eliminate the leakage that could be happening during the day.
Fantastic. I love that. Good actionable takeaway.